Okay, this little video is going to show how a cone beam computed tomography scan, or a CBCT, is read. Now, one of the great advantages of the CBCT cone beam is that it gives us a three-dimensional view of the tooth. And in this particular case, this patient's having some chronic sinus problems as well, and it allows us to see what's going on in the sinus. So for a quick review, in the upper left-hand quadrant, we have what's called the axial view. This is the cross-section view through the roots of the tooth, and as we slice through it, you can see the changes in the outline shape of the root. This is a unique view that's not seen in any other type of dental radiograph. Down here in the lower left quadrant, we have what's called the coronal view. That's your standard side view. A regular dental x-ray is this same angle. And then the third view to the lower right is the sagittal view, and that's a section from the buccal to the lingual. And you can see as we move the green line, it slices through the tooth sagittally and shows us the different slices of the tooth. Now, the way that we get the three-dimensional image is by looking at the individual slices, and the computer allows us to take this volume of data, put it in any angulation that we want, and then slice through it at very thin slices. So this particular scan is a 1 millimeter thick slice. So as I pick up this green line and I move the green line, I'm slicing through, and each radiograph shows us a little bit different information about what we're seeing in the scan. The computer also allows us to adjust the image to different contrasts. So here, as we look at this tooth, we're looking at tooth number 2. We can see, we can also rotate the tooth from any angle. We can then slice through the tooth and see the anatomy, the changes in the bone, and the reaction of the sinus. So looking first at the maxillary sinus, you can see a thickening of the sinus membrane, which is consistent with sinusitis. Now, as we slice through the tooth sagittally, we can see, starting from the back of the tooth, from the distal of the root, we can see the periapical lesion. This is looking here in the lower right quadrant. We slice forward towards the mesial, we can see the distal root, distal buccal root, and the palatal root, and periapical radiolucency that envelops both of those root apices. As we move forward, we can see the mesial buccal root. And if you look at the shape of the tip of the root, we can tell that there's a second canal here in this root that was not treated in the initial root canal therapy. As we look at this a little bit more closely, you can see the existing root canal, the root canal filling that was placed originally is off center to the left just slightly. And if there's a single canal in the root, that root canal filling is going to be dead center in the root. So this tells us there's a missed canal in this tooth, which would be contributing to the periapical lesion and the abscess that's going on here. We can also see that same missed canal when we look through the cross-section view in the upper left. As we slice down through, you can see the outline of the root. This is the distal buccal root, this is the mesial buccal root, and this is the palatal root. The missed canal is right here in this area, the MB2 canal, and we can see that as we slice down through. Now, the advantage of the CT is it allows us to see the anatomy. So as we slice down towards the apex, we can see that those two canals then fuse into one canal at the apex of the root. We can also see the lesion here around the apices of the tooth in close proximity to the maxillary sinus. If we slice through the tooth in the sagittal section and we slice through buccally to lingually, we can see the abscess and the effect that it has on the sinus. You can see a break in the floor of the sinus, and this would allow infection to move into the sinus and irritate the sinus, causing this chronic sinusitis. So this tooth, based on what we're seeing here, we would diagnose as a chronic sinusitis that's being caused by odontogenic sources from this tooth. And the cone beam computed tomography allows us to make that diagnosis and then properly treat the tooth, which will then help with the resolution of the sinus problem.